Good afternoon, and thank you all for joining us today. It's great to see all of you introducing yourselves in the chat box, so please continue to do that if you haven't already. I'm Beth Stroll with the TA Network for Children's Behavioral Health, and I'd like to welcome you to this month's webinar. This is a session of our System of Care Leadership Learning Community. Denise Silsbeck and I co-facilitate this learning community, and we hold sessions monthly. It's designed to support leaders in systems of care, so that could be states, communities, tribes, territories, and includes those both with and without federal grants. So we try to make sure that our sessions and the materials that we provide are relevant for all jurisdictions, no matter what stage you are in developing systems of care, and whether or not you have federal support to do that. We always try to address topics that are important and helpful to you in your work, and we welcome your suggestions for future topics, so please feel free to reach out to us if you have a particular request. This year, we're focusing most of our sessions on operationalizing various elements of the system of care approach, and today's session is focusing on operationalizing family-driven care, which you all know is a core system of care value. I wanted to mention that we like these sessions to be as interactive as possible, and we encourage you to put your questions, comments, insights into the chat box throughout the session. And we have incorporated time for questions and answers at the end of the presentation, and Denise and I will make sure that any questions you enter in the chat box are addressed by the presenters. So just below the chat box, you'll see a box that will allow you to download today's PowerPoint presentation and other resources. And then as a follow-up to this session, you'll receive a link to the recording of the webinar. Also, at the end of the webinar, a link will pop up for a very brief evaluation survey, and we would really appreciate your taking just a few moments before logging out to complete this and give us your feedback. We take it very seriously, and we use it to improve our future learning community sessions. I'd also like to take just a moment to mention our relatively new learning management system called Ideas at the Institute. This is a platform that allows our learning communities to be more user-friendly and more interactive. And on this digital hub, you can join the various LCs, learning communities that we offer. You can register for webinars, find recordings of previous webinars and other resources, and you can interact with experts from the TA network and your peers. And the link to sign up for Ideas at the Institute is on this slide. We do encourage you and your staff and your partners to sign up and take advantage of this system. We're very excited about all that it has to offer. Just to show you a little bit of it, you can see that it's a central repository for training and registration, social media, videos from webinars and monthly minutes and TA tidbits and other resources that come out of the TA network regularly. And then you can also see that all of our learning communities are housed there and the resources. So the orange square there with the TA network learning communities takes you to the home page that's shown below, and from there you can access all of the learning communities at the TA network and all of the resources that they have to offer. So again, today we're focusing on operationalizing family-driven care and family voice and leadership in systems of care. And we are delighted to have two presenters, both from FREDLA, the family-run Executive Directors Leadership Association, Millie Sweeney, who's the Deputy Director, and Jane Walker, who's the former Executive Director and now a Senior Advisor for FREDLA. And the learning objectives for today's session are that participants will understand the importance and value of family engagement, the role of lead family consultants, coordinators, and also effective strategies for outreach, engagement, activation of families and partners in systems of care, as well as strategies for working with family-run organizations in systems of care. I want to mention one more thing before we get started with the content, and that is that we're excited to let you know that registration is now open for our National Training Institutes in 2020 that will take place next summer in Orlando, Florida. June 29th to 30th are the pre-institutes training programs, and there will be one focused on families. And then the institutes will take place from a soft opening on the afternoon of the 30th and for full days the 1st to the 3rd. We do encourage all of you to budget for this and bring a delegation to the institutes, and we hope to see you there. I'd like to also mention quickly that in December, we will be focusing on strategies for operationalizing youth voice and leadership, also at 2:30 Eastern Time, and we hope that you'll put this on your calendar and join us then. Tiara will put the link for registering for the next Learning Community session in the chat box, and then you will also receive a follow-up email with that information. Tiara will also put a registration link for the Training Institutes in the chat box as well. So with that, I'm going to turn this over to Millie, who's going to get us started with today's webinar on family-driven care. So Millie?
Thanks, Beth. Thank everyone for joining us this afternoon. Just real quickly, if you're not familiar with FREDLA, we are a network of family-run organizations across the nation. There are about 120 family-run organizations all across the country, although that's growing. And they were all started by families caring for a child or a young adult with mental health or behavioral health needs. Our whole mission is to build strong, sustainable family-run organizations and together with families really influence policy and practice that supports children and families. As Beth said, we are a core partner in the Technical Assistance Network, and we collaborate with both state and national organizations and offer technical assistance and consultation to family-run organizations, partner organizations, states, and lots of other stakeholders. As Beth said, we are targeting system of care grantees and non-system of care grantees with this webinar on family-driven care. In your system of care funding, there were requirements around specific positions and inclusion of youth and families in development, implementation, and evaluation of the system of care work. However, it's more than the requirements for a funder. It's applicable beyond system of care grantees to anyone who works with children, youth, and families. It's about a commitment to learn about and follow the principles of system of care philosophy, at the core of which is building partnerships with families to work together to figure out how best to support the goals of the children, youth, and families in your particular community. It's understanding that family engagement is what leads to better service delivery systems, policies, and funding that truly work for and with families, and a continuous quality improvement loop between providers, decision makers, and families. That may sound like lofty goals, but there are many strategies and ways to make this paradigm shift. And you have the opportunity to access some of the best experts in the country through the TA network to support this work. So let's just start with the basics. What's required for implementation of a system of care grant? The SAMHSA cooperative agreements emphasize a number of requirements regarding the importance of family and youth engagement. The funding requires the integral involvement of families and youth in all phases: the planning, governance, implementation, evaluation, and oversight of all grant activities, and in the system planning efforts to expand and sustain systems of care. It's required that grantees develop and implement mechanisms to intentionally promote and sustain family participation, such as parent-peer support, development of family leadership, mentoring programs, and the partnership between family, adult consumer and youth organizations, family guiding activities, establishing permanent family advisory and evaluation bodies, and self-help organizations or programs. All services in a system of care, and eventually the broader community, must be delivered within a family-driven framework and that engagement of family is demonstrated through partnership and driving their own treatment, services, and supports. Essentially, families will be fully involved and supported in all planning, implementation, and evaluation efforts of system of care sites. They'll have significant roles and responsibilities that demonstrate grantee commitment to the project. The 2016 through 2018 FOAs added a few more requirements in the area. Coordination with statewide family network grants, having a lead family contact and a task lead for youth engagement, and workforce participation through the use of peer support providers, both family and youth, are to be expanded. And all the activities should be consistent with SAMHSA and CMS information bulletin. Now, the FOA for 2019 requires a lead family coordinator at a 0.75 full-time equivalent to a 1.0 full-time equivalent. To support and ensure family-driven efforts, a lead family contact or coordinator is a required key position in systems of care. The lead family contact, or LFC as I'm going to refer to it, is a critical part of the leadership structure of the system of care and functions as a member of the administration or management team, actively participating in strategic planning and budgetary decisions. The role is not a direct service provider position, but one that can guide and oversee development of effective services and service delivery across systems. LFCs are hired for their lived experience as the primary caregiver of a child or youth with behavioral needs and in navigating systems for their child or youth. The LFC, in partnership with the Youth Engagement Task Lead, inform the planning, implementation, and evaluation of your system of care efforts. They play a significant role in engaging families and preparing them to participate in advisory and policy-making groups, assist in developing family-driven programming, such as parent peer support. They provide training for families and other stakeholders, and they participate in sustainability activities. To fulfill their responsibilities, the LFC requires resources, including a dedicated budget for LFC and family leadership tasks and activities, and the support of the project director and colleagues on the management team to strategize around barriers or challenges encountered in their position or tasks. There are several options for hiring an LFC if you haven't done so. Contracting with an existing family-run organization is perhaps the most effective approach, as family-run organizations have structures that support and promote the work of those with lived experience, as well as expertise in all aspects of family leadership, support, and family-driven care. It's what they're built on. A number of states have hired their LFC within the state or local government or contracted with a family member for the position, usually within or through their Department of Behavioral Health. An LFC may also be employed by or embedded in a mental health center or a child-serving system such as education or child welfare. There's a tip sheet on the LFC position included in the resource list for download as part of this presentation, and it includes further information on the role and the responsibility of the lead family contact, as well as a sample job description and some resources. The TA Network strives to support you in connecting and empowering your family leads by offering resources in a variety of ways. Please ensure that the lead family contact or coordinator has access to the TA Telegram and the TA Network website. Links to both of these are on the slide, and I'm sure they're going to put them in the chat box as well. There are updates, resources, and connection to webinars and other opportunities through the weekly Telegram and on the website. FREDLA is available as the family hub of the TA Network to offer technical assistance and guidance in family engagement and family-driven care efforts. We also offer learning communities and affinity groups specific to these roles in systems of care. The Learning Community for Family Leaders, which Tiara put the link in the chat box, occurs at least 8 times a year, and the Lead Family Contact Roundtable meets monthly for lead family contacts across the nation to interact, share, and support each other's work. The link to the learning community is on the slide, but you can access it through the TA Network website. We hope that both project leadership as well as family leads are on today's call. If you're on today's call without your family leads, or if you've not yet hired your family lead, please share the materials and recording of the webinar and these resources with them, as it can be very helpful as they begin their role. I want to point out, though, it's important to recognize that the lead family contact alone is not sufficient for the development of a family-driven system. When a state signs on to the cooperative agreement to develop a system of care, all partners involved in that funding are accepting responsibility to transform their system to one that is informed, led, and evaluated by families and youth. The lead family contact can guide that effort, but is the responsibility of everyone involved to ensure implementation and change. Family-driven care is a shared responsibility for everyone. Jane, you may be on mute.
Indeed, I was. This is Jane Walker, and might be helpful at this juncture just to acknowledge that the entire FREDLA team, including Millie and myself, are family members with lived experience. So we come to this work through our own many decades of lived experience and have seen how powerful family engagement can be in transforming systems in our own states and in states that we have worked with. So often new system of care sites wonder, where do we even find families? Well, step one in engaging families is going out and doing outreach to them where they are. So FREDLA has developed a tip sheet with different strategies that have come to us through other family-run organizations. So one might say that they have been proven effective. And like all good things, however, it takes time, that is staff time, energy, dedicated resources, and intent to engage families. It doesn't happen overnight, nor does it happen without effort. This tip sheet is also on your list of resources. You can download it so you can read more about the 10 tips that are there. I'm just going to highlight 2 of them that we've come to find as being very, very important in meaningfully engaging families. And one is diversity. So important, we all know, to approach families through their own culture, language, and community, and really understand the traditional knowledge and wisdom around mental health in their community. Secondly, we've come to really understand the importance of appreciation, acknowledging families for their contributions and recognizing their strengths and expertise through things like awards, articles in newsletters, and social media, Facebook, and inviting them to present or co-present at public events. All of these things are meaningful ways to engage families. So we use the term family engagement, but sometimes people use the word family involvement, and we believe there's a difference. Involving families is getting families to participate in activities. It typically benefits the system and is the responsibility of the system to implement. It's the one-to-one relationship with individual families. Often it could be the case manager, care coordinator, therapist, or maybe even peer support provider. Engagement, on the other hand, is a relationship that is mutual, culturally responsive, and supports what's best for children and families. Typically, it benefits everyone involved. It's top-down and bottom-up, and as Millie noted, it's a shared responsibility for all to implement. It's really embedded in the fabric of the organization and the system. It can be seen in policies, procedures, practices, and programs. There is measurable value added with family engagement. It can change, build, improve, inform, and really transform the system in all of the areas noted here, such as changing culture and practice, building awareness and understanding, improving organizational outcomes. And together, it really drives an entire quality improvement cycle that brings about systemic and sustainable change. FREDLA is pleased to release a new infographic today that is titled Family Engagement in Systems. It's available to download, and Tiara, maybe you're going to bring it up on the screen right now. So it really speaks to family engagement in systems as a core value, shared responsibility, one that really is built on relationships that involves the voices of all families. It's an equal partnership. It requires support for families to participate. It acknowledges their expertise and provides opportunities for families to grow. You are the audience seeing this for the very first time. So as I said, it is not on your resource list, but it is available in the box to be downloaded. Thanks. Okay, Millie?
Thanks, Jean. We're excited to release that. So all of those efforts for family engagement and engaging families leads to a paradigm shift from a more traditional medical model approach to one that values family engagement, expertise, and partnership, and the same is true for youth. This shift in thinking helps us to move from a fragmented service delivery system to a more coordinated service delivery system. From limited, more clinically based services to a wide array of services that include and complement those necessary clinical services, to a more focus on prevention as opposed to being oriented on crisis, from a focus on children with the most severe needs in restrictive placements to one on prevention and helping families sustain and maintain children's progress in the community. From a focus on only the child to a focus on the full family as a target of service and support and partnership. And from a culture of creating dependency to one of building on strengths and building resiliency. There are multiple ways to support family participation in systems of care, starting with establishing a culture that values partnership with families and actively seeks their engagement and expertise. This occurs when organizational management and staff commit to family engagement as a priority and dedicate time and resources to supporting families' ability to actively participate. Families often want to be involved, but may have barriers such as finding childcare and transportation. Offering assistance with transportation or childcare expenses can facilitate family members' ability to attend meetings, to participate in groups, and to have a meaningful role in your system of care efforts. Considering convenient locations and times for meetings in light of transportation issues or family schedules is another way to support engagement, as is offering stipends, gift cards, or other compensation for their expertise and time. There is a tip sheet offering these specific strategies and some examples at the link on the slide and also in the resource list for download. In engaging families and being family-driven, activation is the next step in operationalizing that. Once you've conducted outreach and you've considered and set into motion strategies for engagement, put your partnership with families into action. There are many ways in which families can play a role in child-serving systems and within your organization and the community. This graphic provides a quick view of the multiple ways families can be engaged at different levels beyond individual involvement with their child, and hopefully will provide you with some ideas for your own program and organization. The examples listed here definitely are not an exhaustive one, just to give you an idea of how they fall into different categories. Across the top, you see the 5 categories of roles played by families and increasing levels of involvement. Listed beneath each category are specific examples. Underpinning all of these engagement strategies and roles are core components that are necessary to facilitate true and effective engagement: safety, transparency and trust, empowerment, choice, collaboration, mutuality, cultural responsiveness, and peer support. For example, family members can inform the content of your agency's materials or the best way to conduct outreach to other families. They can also act as consultants via focus groups or sharing their experiences as consumers of your services. They can be involved as co-presenters with you in workshops or trainings, or collaborate with you by leading support groups for parents of children in your program or participating in an advisory group for your organization. Parents can be empowered to become parent peer support providers and be hired as staff in your agency or grow as family leaders in the community or region. Establishing these roles can be part of someone's job responsibilities, like the lead family contact. It can be stipend work for family leaders, or it can fall into a more structured partnership with a family-run organization through a contract. Most importantly, however, they can all happen at the same time. It's not a linear process, and it really could be more about the task at hand that you're trying to accomplish. It's also a developmental process of skill and growth for families to feel able to step into some of these roles, maybe starting with informing and then moving to collaboration and being empowered to take on employment as a parent peer support provider. These are some of the activities and roles at the state or local system and policy levels that are filled by families and systems of care across the country. You can see that they fall under the categories on the table we just reviewed. Families are part of education for the community as a whole, as well as family groups, organizations, and system partners. They're valuable partners in the design and implementation of services and support. They have expertise in what works and doesn't work for families and can help with policy development and the more efficient use of funding. Families are also good at finding other families, so they should be involved in your strategic communication, outreach, and leadership building efforts. At the child and family level, there are also numerous roles and activities for family members. They facilitate support groups, helplines, and trainings. They offer parent peer support services, both individually and as part of a larger treatment team, as well as being embedded in child-serving systems as partners. Often, parents of children with behavioral health needs feel isolated from other families, so social and recreational activities offered through system of care programming are a vital link to building a sense of community and developing informal networks of support. Family leaders can host and facilitate such activities, in addition to skill building, navigation, and many other supports. To support the inclusion of youth and family across all the moving parts of your system of care, Youth Move and FREDLA developed a series of guiding questions from the FOA and federal grantee site visit requirements. Those are all listed on the slide. This list of questions was created by youth and family leaders applying best practice to grantee requirements. The full document is available on the resource list, and we can also send that to you. It's available for download on the FREDLA website too. We encourage you to use these guiding questions as a framework for youth and family engagement in your system of care. Some suggested uses include guidance for leadership and governance committees for implementation of system of care values and principles. You can use it as a checklist to describe your efforts, challenges, and accomplishments in family-driven care, engagement, and leadership. It can be used as an internal planning and improvement process, as well as part of your continuous quality improvement. We want to go through some examples for some of these core areas, starting with strategic planning. Based on lessons learned and best practices, we strongly recommend that sites practice this process from day one. Youth and family need to be at the table from the very start of the work. Many sites neglect family engagement in the initial stages and all of the things you have to do to get started, even applying for and being awarded the grant. They then find, though, the need to get back on track. We see this throughout our experiences with technical assistance, and the importance of having families involved in strategic planning is borne out in the evaluation data as well. Some of the ways to engage families in this process include gathering information directly from them about needs, gaps in services, and identifying what they would find to be most useful or needed. It's important to establish roles for families in each of the core areas of the system of care process. That includes policy, program design, services, and evaluation, and also specific methods for recruitment, training, and retention of family members in those roles. Families should be involved in deciding on the need for family programs, or is there a need to build a family organization, and what does that need to look like? Most importantly, you must plan and budget for associated activities, tasks, and time for all family programming, supports, and activities. I think Jane is going to share an example of what this might look like.
Well, when it comes to getting input from families, it's really incumbent on everyone to go beyond families that are at the table and to really utilize multiple strategies to get input from those families who are not able to be at the table because of their jobs, their caregiver responsibilities, their language, and even their level of confidence. But it's really their voices that are critical in planning to ensure services are really meeting the needs. Using strategies such as focus groups, surveys, listening posts, even one-to-one interviews in the community can be invaluable. And families should really be driving that process to get the input, using them as the focus group facilitators, as the ones who are developing the survey, or maybe the ones going out and doing the interviews. So again, it's all family driven. So examples of governance, we talked about family engagement as being top-down and bottom-up. And governance is certainly an example of the top-down and can really demonstrate the commitment to family engagement in the system. It means that multiple families are supported as needed to participate, so it is not a token one or two families. And it's representative of the community so that there are diverse families represented as well. It means that families and other members of the group, the agency representatives, all have training on working together and respecting each other's roles and opinions. It means families have meaningful roles and have opportunities for leadership roles on committees and work groups. It means information is shared with families just as shared with other members of the group. Some examples that have been very effective that we've seen are things like tri-leads, where there's a youth, family member, and a system partner as a co-chair. Another example is South Carolina that you can see from this diagram that families are engaged at all levels of the system and governance, system management, as well as the service level. This is the ideal that we're all striving for. Family engagement throughout the system involves multiple components that should be present, and that means membership and authority of the group is clearly defined. The composition of the group has sufficient representation of diverse family members. The voting structure is equitable in decision-making. There's an orientation and ongoing support for family participation. And very importantly, there is a modeling of the value of family engagement, such as having families in leadership roles where everyone is looking up to the family member as the leader. I would add that I've seen the role of the chair in any work group, committee, or structure as being key. I've seen chairs of committees make it a point to personally call and welcome a new family member when they join a committee and really invite their participation. That's been very, very meaningful and very effective. Simple thing like a phone call. Up to this point, I think most people would be agreeing with much of what has been said on this call. When it comes to finance and funding, it's often a different story. For various reasons, families may never be given a budget or even informed how the funds are allocated or why, and much less have a say in how funds are spent. Families really should be involved in discussions of funding priorities for services and supports and can be invaluable in exploring more effective ways to use existing funds. Contracts can include clauses that require meaningful family engagement in selecting, implementing, and evaluating services with your subcontractors or providers that are also doing work on your system of care. Family engagement itself should have a line item in the budget for family support and activities, and families should have control of that in how those funds are spent. And it needs to be very clearly spelled out. We've seen situations where there's some feelings that the families are given a right to ask for something, but it's all pending approval of somebody else. So clearly spelling out what is the process for the utilization of those funds and approval. Family engagement at the service level is evident in many states who have actually embedded family leaders in their state or local government. This has been done in states like Pennsylvania, New Mexico, Oregon, Washington State. Family leaders are hired within state or local government and are a voice from within the system. They serve a somewhat different role, but also an equally vital role in assisting in the development of the certification process and standardized training for statewide parent peer support, oversight of certification and TA for family peer support workforce, oversight of contracts with family-run organizations, and serving as a liaison and technical assistance for family-run organizations. And also they play an important role in policy making. In Oklahoma, for example, there is a family lead involved in the development of policy and practice at the state level that supports the development of county-level system of care and provides TA to both counties and family-run organizations. A growing area for family engagement is parent peer support. 30 states now have Medicaid reimbursement for parent peer support, and we're seeing parent peer support expand beyond child serving systems, I should say across child serving systems, and spilling over into settings such as emergency rooms, mobile crisis teams, detention centers, schools, residential treatment centers, and more. And along with that is the emerging role for parent peer support supervision. Evaluation is also another vital example of roles for families in the system to ensure that services are based on what really works for families. Some sites have established family advisory groups specifically for evaluation to identify what should be evaluated, interpret, and disseminate the results. Other sites have also hired family members to serve as evaluators by conducting interviews. This has proven effective in getting better quality of data and also in the retention of families in the evaluation process over time. Nellie? Millie?
Sorry, I was on mute. Communications, messaging, and partnerships. Families can be instrumental in your strategic communications. They know where families are. They know how best to reach them. They're aware of cultural nuances and what interests the families in the community. Engaging families in the design, implementation, and evaluation of your communications and messaging strengthens your efforts and will lead to more relevant, impactful outreach and social marketing. Let me share a few examples on this slide. U-Ford in Massachusetts produced a video on the importance of mental health. Youth and their families identified topics. Youth and parents were involved in the making, from what the script looked like to the music that was played in the background. Together, they developed this video from images to messaging to the music, and it made the video more reflective of their community and therefore much more effective in their outreach. In Pasadena, California, a communications and consultant or a firm, they held a focus group with youth and a Youth Move chapter there to give feedback on a brand awareness campaign. What they learned was that the youth didn't feel it reflected exactly who they were, and they used the feedback to lead to a change in language and in images that more fit the community and the target message they were trying to get across. The same is true with Miami-Dade in their Therapist Be Like video, which is definitely one you should check out on YouTube, where you can see from the youth's perspective what it's like going through therapy and how it might be more effective to reach them. In Somerset County in Maryland, they employ family members to conduct their outreach activities in rural areas because they know and are respected voices in those communities. Outreach and information directly from family members to other families is more likely to be heard, used, and shared within that community, and therefore more effective. As you're working towards system change, consistently assess that you're engaging family voice in your efforts. There are a number of tools for this, as well as technical assistance around implementation and how best to use that data. One tool specifically developed for this, however, is the FAMVOC. The FAMVOC, which stands for Family Voices on Committees, was developed in 2018 by Fredla and Portland State University. It's intended to gauge the extent to which councils, committees, and advisory boards support family voice by engaging and supporting family members to be active and influential members. The FAMVOC assesses support for family voice along 4 themes: overall vision and commitment, collaborative approach, empowered representation, and support of family members' participation. It can be used to measure the current level of support for family voice within a group, but it also provides an opportunity for learning and growth, as it can be administered at regular intervals to show change, such as every 6 months or once a year. Scores are tabulated, and a report is developed that highlights where a group scores in each of those theme areas, as well as offers resources and strategies for improving family voice in the areas with lower scores. If you're interested in accessing this valuable tool, please reach out to Fredla. Melissa Pearson is our point person on the FAMVOC, and she can be reached at mpearson@fredla.org. We'll put that in the chat box.
So we've mentioned family-run organizations multiple times in this webinar, and they can be one of the most effective ways to engage families at all levels of their system of care. They are organizations governed, led, and staffed by family members with lived experience caring for a child or youth with mental health needs. They have experienced the system firsthand and have also been trained to support other families navigating the system. Families come to them and trust them. There are family-run organizations, as Millie mentioned, in almost every state, and if you need to find one, the link is available, I believe, on the resource list that can be downloaded from here. Fredla has a tip sheet also available to be downloaded on family-run organizations that really emphasizes the multiple roles that they have in supporting families and strengthening communities. They represent and engage and involve many families from the community, and because they're embedded in the community, they really understand the culture and the issues in the community. They fulfill roles at system and policy level in their states and communities. They provide a valuable perspective from people with lived experience to improve services and systems. They are good at recruiting, training, mentoring, and supporting family members for policy and system-level participation. We have some great examples of programs that family-run organizations have implemented in partnership with their systems to recruit families and mentor them while they're serving on committees. They fulfill roles at the child and youth and family level, as we mentioned, in terms of peer support, and they recruit, train, certify, mentor, and support family members for roles at service delivery. They also provide lots of training and lead and participating in social marketing and strategy communications, such as the ones that Millie highlighted. Family-run organizations can truly be a strong ally in your system of care. These next two slides are some ways in which you might build and sustain a partnership with a family-run organization, such as establishing a policy that requires all partners to work with family-run organizations, including providers you may subcontract with or your partner agencies. Write it into your governance document for your system of care. You can also contract with family-run organizations, developing a scope of work and entering into a formal contract or MOU for deliverables. You can also really educate others on the benefits of working with family-run organizations to build and operationalize family and youth voice and leadership, as well as impact policy that would support such partnerships. We know that family-run organizations throughout the country are contracting with child welfare agencies and juvenile justice agencies and education. In all instances, it began with a contract with mental or behavioral health, and it expanded across systems because family-run organizations have been proven to be so effective at what they do. It's critical to provide appropriate resources to accomplish this work that needs to be done. This applies to funding, materials, and time necessary to build family and youth programs and organizations. Plan now through the data that you collect to quantify and use qualitative data as well to show the effectiveness of youth and family involvement, activities, and outcomes. And identify how we use this data along with youth and family voice to grow and sustain a family organization beyond the federal grant. We've unfortunately seen many who were built during a system of care grant and later to not be sustained. In some areas of the country, there may be no family organization at this time, or one may have started that is no longer active. In these situations, the system of care site can play a key role in actively incubating an emerging family-run organization in your system by providing financial support and technical assistance around organizational development and operations until the organization is ready to stand on its own feet. This can take time, so it's best to begin early and engage families from the beginning in building or rebuilding a family-run organization if that is what the families are asking for in your community or state.
System of care was built because of families and with families. And legislation was passed for system of care because of families. Funding happened because families were involved. So really you can't sustain a system of care without families involved from the very beginning. Families are the one constant in a system of care and really across all the systems and can be the most powerful voice and context for these types of shifts: culture, policy, program, funding, that all need to occur to develop and maintain a coordinated system of services and supports, with or without grant funding. Sustainability starts early, and it's not just about money. It's about establishing structures that facilitate an ongoing coordinated system of care. It's about those policies, those funding streams, the expectations that you set for doing business with families and family leadership. Your goal is to build clarity, to build capacity, and to build culture. To maintain and improve systems beyond the grant funding, partner with the families in your community. Build in those structures to fund all of the pieces that families say are important, not just traditional mental health services. Establish clauses and contracts that require meaningful family involvement in selecting, implementing, and evaluating those services. Use those guiding questions regularly to check that you're being family-driven in all of your work in systems of care. And of course, know that the TA Network and FREDLA are here to support you every step of the way. Thank you for spending time with us this afternoon and for signing on for Family-Driven Care and Systems Change.
Thank you, Millie and Jane. We have a few questions for you, and hopefully we'll get some more in the chat box. First, Kristen has asked, can you go further into how engaged families, so when we have families engaged, how can they help us obtain the voice of those who cannot be engaged due to outside forces such as parenting, jobs, et
Thanks for that question. This is Jane, and I'll give you a couple of examples from when I was the director of a family organization and felt a very strong, heavy responsibility that it not just be the families that we knew. And so we developed tools such as SurveyMonkey. It would go beyond what we ever imagined it would go. And they were simple questions that were developed by families, and it was sent out, providers sent it out to families, and it really went way beyond what we ever dreamt in getting feedback. So that's one strategy. Another one that we found very effective is doing focus groups across the state. All of those focus groups were led by family members who were trained to run focus groups with note takers in a very objective way so that the information was, very unbiased, as you will, and we always asked for what was the best thing about the system and what was the thing that was most challenging to you and what would be a priority. We got some amazing information from those tools. The other thing is if there are parent peer support providers, asking those parent peer support providers to reach out to families maybe that they're currently working with or have worked with in the past. We've also had, in some instances, other providers agree to send out, hand out, surveys or questionnaires and support families in completing them. I've had many experiences where a family may not either have English as their first language or have a literacy level where they would be struggling with completing, and so always ensuring that that support is available. We don't have time here, but I can tell you how there have been multiple instances where we thought we knew the answer, we thought we knew the priority, and after getting that input, and we kind of set a bottom line that we had to have input from 50 to 100 families, not that not serving on committees, not employed by a family-run organization, get the input from 50 to 100 before we felt like we were on track and we could see patterns. So I hope that was helpful.
Jane, this is Denise. That was very helpful. One of the comments you had made is that sometimes some of those outside forces can be the parents don't yet see themselves, or caregivers don't yet see themselves in that role. So I know, because I got to work with you for many years, that the Maryland Coalition of Families for Children's Mental Health developed the Family Leadership Institute, and I wonder if you would just say a few words about that.
Yes, when we opened our doors, I felt like we needed an army, and there was only one person, me. So one of the very first things we developed was a Family Leadership Institute to build that cadre of families who could serve on committees. So it was very different from peer support. It was specifically to build leadership. We invited in representatives from multiple different agencies to meet with families, and we found the secondary benefit was not just that the families learned about the agencies, but the agencies learned about the real needs of families. It became something that agency people look forward to every year, because they felt they came away with so much. That program has been going on almost 20 years now and has graduated multiple classes every year. So that's a wise investment in a system of care to build a leadership program. There are many available, and FREDLA can certainly provide assistance in helping to establish one if that's something desirable.
Thank you, Jane. It's a great role for that lead family contact to help establish and develop that leadership training academy, whatever. Mm-hmm.
Mm-hmm. Great point. Thank you, Millie. Millie, did you have anything to add to that response?
I would just say that families know where other families are, and so if you have a couple of engaged families, they will tell you, I can really be able to reach out to family members at school, during a certain event, or I would be happy to hang out in the waiting room at the mental health center, and ask people to, a couple of pointed questions. We had a lot of luck in the last couple of years with FREDLA in contracting with family-run organizations to do focus groups, because we were trying to get a national view of some particular topics. And they were held virtually if families could not get there on virtual platforms, or they would come to the family-run organization where they were comfortable, and we would facilitate virtually. And that was really helpful, because it could be on the family schedule in a location that they felt very comfortable sharing information.
Mm-hmm. That's a great example, Millie. We were asked by SAMHSA to provide input into development of guidelines around antipsychotic meds for children. That's a huge issue for families. And so we struggled that, we could not have just the input of FREDLA team members. We needed to go out. And as Millie said, we were able to do the entire thing virtually and did 8 to 10 focus groups involving families in 26 states around the country and got incredible input. So I also wanted to add that Millie's point about families know other families, many families have closed Facebook pages where there are families who are talking to each other. So asking those people to send a survey or information about a focus group out through their closed Facebook pages is also a very good strategy.
Now that's a good one. So we can provide information and follow-up to this meeting in the learning community and send it out with a recording about other examples of family leadership institutes. We have another question from Ellen, and that question is, what kind of infrastructure? I'm sorry?
Oh, okay, go ahead.
what kind of infrastructure do leaders and family organizations need to be thinking about and implementing in order to be full partners in the delivery of billable family peer support services while keeping the values of family involvement intact, or the family movement intact? So a lot about infrastructure within a family organization, a billing, Medicaid organization, and then keeping those values intact.
So we need to schedule another webinar on that. That's huge. However, I would point you to two documents that Fredla did, and Fredla did them in partnership. And one incredible document was done in partnership with Beth Stroll, who's on this call. One was called Considerations for Family-Run Organizations who are considering being a Medicaid provider. That kind of laid the philosophical groundwork to exactly the point that you're making of, if you become a Medicaid provider, do you give up your value of family-driven? And so that document really identifies what those critical considerations are for family organizations to discuss with their boards, with their staff, to really look at their infrastructure. And then the second document, and we can send those out, they're on Fredla's website. And Beth, maybe you want to add to this. This was really an implementation guide around family-run organizations becoming Medicaid providers. And Beth, you did an incredible, we were truly blessed that Beth wrote this guide for us, but sought the input from multiple family organizations. So Beth, maybe you should add something here.
Well, I think the link for that document is now in the chat box. And, you know, while it was done a couple of years ago, I think it's still very relevant and profiled organizations at different stages of development of accomplishing this within their states. So I think it could be a, you know, it's a good resource for family organizations just beginning the process and others that are further down the line. One of the things that I wish we could do now is to update this to focus on youth and young adult peer support as well, and how to begin to get that to be covered more by Medicaid, by other state funds and such, because I think we're a little further ahead with parent peer support than we are with youth and young adult peer support. Would you agree with that, Jane?
Yes, I agree.
There's another document that will be coming out on organizational readiness that lays out the different steps to get ready to have parent peer support programs for those that are not family-run organizations. And that's in review right now by SAMHSA before it comes out, but it has resources around these particular things and how you start infusing peer support programming in with your other programming. Has a lot of good tips and resources, and I probably have folders of resources on this for how you make this happen, because there are a number of things to consider, you know, from documentation to what your rate is and what how you put it out to the community and how you conduct supervision so that it meets the needs of someone using their lived experience in a professional way. There's a number of components in there. I think Jane is right when she said we need a whole other webinar on that.
Yeah, it's huge. And lastly, I think the matrix, I'm not sure if the matrix is out yet or not. There was a matrix done a number of years ago identifying those states that had Medicaid billing for peer support, how that was defined in each state. That has been updated. At the time, I think there were 20.
I think it's the final review right now.
And now there are 30 states. So you can look for that being out soon as well. That's a boatload of work done by the Institute to pull that together, and we're anxious for that to come out.
That was also a very good plug and reason why folks should be joining our learning communities so they get these resources as they come out the gate. The peer provider matrix with the rates from different states is under review at SAMHSA. However, if there is a technical assistance need and folks want to reach out to us, we could help you identify some states that you're interested in. So please do reach out if you would like that. And Ellen is responding, would love a webinar on this topic, including contractual service provisions, supervision, progress, how to design outcomes, and all of that. So thank you, Ellen, and we'll see what we can do about that. We do have another question here. If the project a person is on is ending, if it's in its ending phase, how can this leader become involved with families, involve families without them feeling like token families or their impact is limited to a survey or an interview? So what do you do when system of care funds are going away, we don't yet have a sustainable source for continued funding for a family position or better yet a family organization? What are those nuggets that they can continue to do that don't feel like tokenism?
The first thing that really pops to mind is having a feedback loop. Make sure that if you're gathering information from families, they understand the purpose of it, and you go back to them with how it was used. You know, what is changing as a result of that, or if something isn't changing, what are their thoughts on it? What's a different direction to go? So the first thing that, as soon as I read that, I thought you've got to have a feedback loop so that they know it's not token. Go ahead, Jane.
Well, I would also suggest that the families develop language that they can present to, if it's a local jurisdiction or state, whatever, that gets language about family engagement in some kind of regulation, legislation, whatever it might be, so that it's not lost. And that the families be the one driving that, so they can see the outcome of it, and then use that legislation to really take that and ensure that it's implemented throughout. I was working with a community not long ago where this had been done a couple of years ago, and all of the agencies had forgotten about it. And the family, there were a group of families, and they knew that this memorandum of understanding had been signed, and they resurrected it and respectfully met with all the agencies and said, you know, this is a commitment, and how can we ensure that this is going to happen? So I think with some support, mentoring, guidance, to help the families really take that and make it real for sustainability.
Mm-hmm. You see, I believe Jill is echoing you. Link the work to what's important in the communities. What is the high impact in the community or with their families? And Luann, hi Luann, is saying this is very exciting. It actually helped me frame some areas that she's been trying to find direction.
Oh,
are there any other questions? Yeah. Great to see familiar names today.
I would love for this discussion to continue on. You know, obviously PA Network is here for you guys for this, and particularly around family engagement. You know, Fred Love would love to support what you're doing.
Yes. Yeah. And link you with other sites that can also help from lessons learned and successes. Yeah.
Looks like there may be a couple of additional questions coming in or comments. We'll give people a moment for that. Here's one from Karen. Is this shareable information? Can some of the information be included on our training tools? I think everything that we produce at the TA Network, our goal is to get that out into the field as much as possible. So yes, as long as there's attribution and proper references, we're happy if our work is spread in your states and your communities.
Absolutely.
Mm-hmm. Yes. That's what we're here for.
Please use it.
Mm-hmm.
Any other questions? And we appreciate the good feedback coming in. We may be able to give you a few minutes back in your day. Let's see if another question or two comes in. Okay. All right. In the meantime, let me begin to wrap up here. First thing I'd like to do is remind you that when we do close, we would ask you to please hang in there with us for just a couple of minutes longer to use the link that will pop up so that you can complete the brief evaluation. And I'd like to thank our presenters, Millie and Jane, for their outstanding work on this learning community session, and of course in the area of family engagement and leadership, and for their partnership in the TA Network. I think they've left you with a lot of ideas and practical strategies that you can apply in your states and communities, and as they emphasized, we and they are available to help you do that. There are some resources listed in the PowerPoint here that you can see, and those will be available when you download the PowerPoint. You'll be able to access all of those. Before we close, I do want to note that there will be a webinar on authentic youth engagement. The date on that has changed, so please note that this will now take place on January 28th. We encourage you to attend that. And thank you also to Tiara Brown from the TA Network, who handles all of our technical aspects and does it so well. And another plug for the next Learning Community meeting on December 18th on Youth Voice and Leadership. The links, as you know, are already in the chat box, but you can also find them in our weekly TA Telegram. So thanks to all of you for joining us this afternoon. Thanks again to Millie and Jane, and please do take the survey.
Thank you, Beth, for having us.